Even the smallest joints in our bodies can obviously cause us pain, as was the case for Leslie. Let's look at her story.
About 2 years ago, I woke up and my thumb was in extreme pain. When I actually bent it, it felt like it was breaking in half.
The doctor told me I have trigger finger.
This is as much as I can move it without pain right now. Day-to-day activities have become very challenging and difficult to do. Brushing my hair, using the curling iron.
It affects everything that you do.
I am so excited to get this problem resolved.
Let's see how Leslie's surgery went.
Good morning. I know it's painful. Just try to bend for me if you can. And just let's look compared to the other thumb. Bend that as far as you can, just kind of show the difference here. So that's how all you can bend the left thumb. Okay. The condition is called a trigger digit, or in this case, trigger thumb. I'll make a little cut through the skin here, and then I'll be looking at the band. I'll make a little snip of that band, and then we'll wake you up, and then 3 stitches later, you're done.
How long will the actual procedure take?
It's going to take about 5 to 10 minutes total time. I think you'll see marked improvement in your mobility while you're on the operating room table.
I'm looking forward to bending my thumb again.
Now we're just going to make a little incision through the crease of the thumb, and we're just going through the tissue down to the tendon. Here's the band we're going to snip, and I'm just going to put my scissors right underneath this band. And we're just going to wash the wound out and with some antibiotic solution and put a few stitches in.
Noel, we're all done, sweetheart.
This is what she couldn't do before surgery. Bend your thumb all the way for me, sweetie.
All the way, Noel.
There you go. See that? Right. As you could see, got the tendon completely released. Now she has full mobility. I think Leslie will be happy. Look at her right now. She's moving it completely.
I feel good in my thumb. I can move it. I'm so excited. Look at that.
I'm here with hand surgeon Dr. John Knight from the Hand and Wrist Institute in Beverly Hills, California, along with his patient, Leslie. So before we talk a little more about what this trigger finger is, can you show us?
Oh, I can bend my thumb. I'm getting all the strength back.
I don't see it catching.
Nope.
No pain?
No pain.
Wow.
No pain. I wish I would have done it a year and a half ago.
Well, I'm glad that you came to get resolution, because a lot of people suffer from trigger finger, right?
Right. It's the most common procedure we take care of as a hand surgeon, more common than carpal tunnel.
So let's show people what trigger finger is. I know we have an illustration here.
Sure. On the illustration, you'll see bands or tendons that go to the tip of the finger, and it's in the palm area that you get a little swelling or inflammation around the tendon. Eventually, over time, you actually may form a nodule, and that nodule is like a rope going through a pulley. It starts to snag.
And we have a demo here. I don't know if this is really going to do justice, because it's obviously difficult sometimes with demos. But again, this is the tendon. It's going through that sheath, and this is one without...
Right, no friction, smooth gliding, and that's in all the tendons that bend the fingers down go through a system of pulleys. And then there's usually the first pulley that's in the palm or at the base of the thumb, and it forms a little knot on it, like this knot on this rope here, or this ball, and it impedes the thumb movement. So when we do the surgery, you just snip it, and that relieves the pressure.
So by getting rid of that, then it obviously moves freely through the pulley system, as evidenced by your quick recovery.
Yes.
Are there things that people can do in their daily lives to hopefully prevent this from occurring in the first place?
Absolutely. Surgery is a last resort. The first thing is looking at ergonomics, less repetitive use, too much texting, too much keyboard. Rest that as much as you can. Over-the-counter anti-inflammatory medicine, and just rest. And then the hallmark of conservative treatment is a cortisone shot right where the tendon is. If it's mild case, then it can respond favorably to that. In her case, though, when you can't bend it at all, that's a pretty severe case. It's not likely to respond to conservative treatment.
So surgery is a last resort, but it is an option for people who just have no resolution with conservative treatment. So happy that you're feeling better.